I'm Angel. I'm going to be your student nurse today. I'm going to be doing your head-to-toe assessment. Can you tell me your name and date of birth?
Jeremy James, 8/26/81.
Okay. I'm going to wash my hands and put on some gloves. I'm going to start with your assessment of your head. Can you bend down a little bit for me? Your scalp is normal cephalic. There's no lumps or masses noted. Your scalp is clean. Your hair is clean and free of infestations. Your skin color to your face is consistent with the rest of your body. And there's no lesions noted to your face. Your eyebrows and your eyes are symmetrical to your face. I'm going to palpate your sinuses. I'm going to start with your frontal. Tell me if there's any tenderness.
No.
And your maxillary, any tenderness?
No.
Okay, there's no swelling noted on palpation. I'm going to check your eyes. You can look at me. Okay, your pupils were reactive to light. Also, I'm going to have you follow the pin light. Okay, can you look at the wall and back at me? Okay, your pupils were equal, round, reactive to light, and accommodate. I'm going to check your sclera. I'm going to lift the upper eyelid up on both eyes. If you could look down for me. Your sclera is white and moist. I'm going to check your conjunctiva. I'm going to pull down on your lower lid and have you look up. Your conjunctiva is pink and moist. I'm going to check your ears. I'm going to palpate your auricles. Is there any tenderness?
No.
Okay. I'm going to look in both ears. No drainage or excessive cerumen in either ear. I'm going to assess your nose. Your nose is midline and straight. Can you flare your nostrils for me? Your nostrils flare symmetrically. Can you sniff? Sniff. Your nares are patent. Can you look up for me? I'm going to look in your nares. Your mucous membranes are pink and moist. There's no nodules, no septal deviation noted. Okay, I'm going to assess your mouth. Your lips are moist, no cracks noted. Can you open your mouth? Your mucous membranes of your mouth are moist. Your tongue is moist. Your teeth are in good condition and no missing teeth. Okay, looks good. Now I'm going to assess your neck. Your trachea is midline and your thyroid gland is not visible, so that's good. I'm going to listen to your carotid arteries for any breweries. You can put your head down. There's no breweries noted. If there were, that would indicate stenosis, narrowing of the artery, or clogged artery. And now I'm going to assess your anterior thorax. I'm going to feel, and your skin is warm, dry, intact. There's no lesions. Can you take a deep breath for me? Your chest rise and fall is symmetrical. There's no visual pulsations noted. I'm going to listen to your lung fields. Just breathe normal. Okay. Your lungs are clear on auscultation. There's no crackles or wheezing noted. No abnormal sounds. And now I'm going to assess your heart. And your heart is at your second left intercostal space to your fifth intercostal space on the left. I'm going to start with your aortic at the second right intercostal space. Then I'm going to go to your pulmonic that is at your second left intercostal space. And then I'm going to go to your Erb's point at your third left intercostal space, and then your your tricuspid at your fourth intercostal space, and your mitral valve at your fifth intercostal space on the left side, and that's also where I would listen for your apical pulse. So I'll go ahead and listen or auscultate, and there is no arrhythmias. Sounds good. Okay, do you do a monthly breast exam?
No.
Even as a male, it's recommended, especially if it runs in your family. So I'm going to walk you through on how to do a breast exam. It's recommended to do it at the first of the month, so that way it's easy to remember. You take your right arm, lift it up, put your hand behind your head, and then with the opposite hand, start at your axillary, and you're going to move around in a circle around your breast, feeling for any lumps or anything abnormal. And when you come around, squeeze your nipple and look for any discharge. And if you have any discharge or any masses felt, you need to notify your primary care physician and have that checked out. Okay, I'm going to check your upper extremities now. Your skin color is consistent with the rest of your body. Your skin's dry, intact, no lesions noted, no edema noted. And check your pulses. We have your brachial, they're present and symmetrical. And then we have your radial pulses, they're present and symmetrical. There's no clubbing of your fingers. And check your pulse refills on both hands, and they're less than 3 seconds. I'm going to check your range of motion. You can follow me. We have flexion, extension, adduction, abduction. Okay, that's good. Range of motion is within normal limits. Can you lift up on my hands? Now push down. Your strengths are normal. Now I'm going to check your posterior thorax. Your skin color is consistent with the rest of your body. Your skin's intact, no lesions noted. Your skin's dry. Your spine is symmetrical, no curvature of the spine. I'm going to auscultate your lung fields. Just breathe normal for me. Now I'm also going to listen to your right lower lobe. Your lung fields are clear on auscultation. There's no cracks, wheezes noted. Okay. Now I'm going to check your abdomen. If you could lay back for me. Okay, your abdomen's flat and non-distended. I'm going to palpate your quadrants and also feel around the liver, the spleen, and the kidneys. There's no masses felt. Is there any tenderness?
No.
Okay. I'm going to auscultate your bowel sounds in all 4 quadrants. We'll start with the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. The bowel sounds are present and normal. They're not hypo or hyperactive. Before you can determine if they're hypoactive or not present, you have to listen for at least 5 minutes in each quadrant. Okay, I'm going to have you go ahead and sit up for me. I'm going to assess your lower extremities. Your skin color is normal. There's no edema noted, no lesions. Your skin's dry and intact. I'm going to check your pulses. We have your posterior tibial, which is present and symmetrical, and your dorsal pedis or your pedal pulse, and they're present on both and symmetrical. Your cap refills on your toes are less than 3 seconds. I'm going to check your strength. Could you push down on my hands? Okay, now push up. Your strength is good and normal. I'm going to check your range of motion. We have flexion, extension, abduction, adduction. And your range of motion is within normal limits. And we're done.